Hi, everyone. My name is Dr. Treva Reicher. I'm a board certified nurse practitioner who specializes in longevity medicine and hormone optimization, and I utilize bioidentical hormones to optimize your health. I'm going to tell you a little bit about myself, and then we're going to talk about why hormones matter and what bioidentical hormones are. And we're going to talk about one symptom that you may be experiencing. So I'm going to tell you a little bit about my life. Yes, I am in a trailer. I currently live in a 25-foot trailer. Yes, I did say 25 feet. It's not the best situation, but we are in the midst of construction, so that's the reason why I live in this trailer. It's not great. I sometimes hate it, but I have embraced a saying recently because it's all about a balance or the yin and yang, right? And so that saying is embrace the suck. And the only way for you to embrace the suck is because that's how you're going to enjoy life. Life is all about the joys and the sorrows that we experience. You have to have both. It is about a balance. And so I'm going to embrace this suck because I know something better is coming. Anyway, so I grew up in a very multicultural family with two very hardworking parents. They were blue collar workers. I paid for my own education because they were not able to afford to pay for it. My mother is Jewish, and she was a grocery checker at a local grocery store where she met my stepfather, who's been in my life since I was 2. So he's my father, right? He raised me. But anyways, he is Chinese. He was born and raised in El Salvador. So because they both worked, I also had babysitters that took care of me while they were at work. And those babysitters were Spanish speaking only. So I actually learned a little bit of Spanish. And I try to utilize it as much as possible. So I'll teach you a little bit of Spanish throughout this. So I'm going to tell you about mi vida, which is my life, that hopefully you can identify with a little bit of it. Because really what I'm trying to teach you is that we're really all just human beings. Despite our sex, our religion, our ethnicity, or where we grew up, or our sexual orientation. Really what boils it down is that we're all humans. We're humans in one world. So we're all together in this life, our life, nuestra vida. So I had children at a very young age. I don't condone that at all. It was very difficult to have my children very young, but I got through it. I had my first when I was 19 years old, and started into trying to get into nursing school at that time, but because I had children, I had to wait a little bit. So it was about 10 years later that I went into the nursing program. I had my fourth child at that point. She was 4 months old when I went into the nursing program. I was breastfeeding her at the same time I was going through nursing school, and I was homeschooling my 2 oldest children. It was one of the hardest things I've ever done in my life, but I did it. And so if I can do it, you can do it. Anything that you put your mind to, you can do. That's what I fully believe. They made me be a better nurse, and that's because I feel like nursing is very similar to being a mother, in that you are caring for other individuals. So since I loved being a mom, it made sense to me to be a nurse, and I have since then pursued higher degrees and higher certification throughout my entire nursing career, to the point that I went and got my doctorate of nursing practice at the age of 50. So again, if I can do it, you can do it. Anything that you put your mind to, you can do. Your dreams will not be made to fruition, meaning that they won't come about unless you pursue them. Things don't just fall in your lap. You have to actually pursue them. Anyway, so why do hormones matter? Your endocrine system produces hormones that control many parts of your body's functions, including metabolism, stress, sex drive, mood, regeneration, and more. When your hormones become off balance, even slightly, both men and women experience a variety of problems. So what are bioidentical hormones? Bioidentical hormones are derived from a plant-based source rather than an equine or horse's hormones. So in other words, from another animal that's not ours. So they come from wild yams. They contain a certain chemical that compounding pharmacies actually take that chemical and they convert it into synthetic bioidentical hormones such as testosterone, estradiol, DHEA, pregnenolone, and progesterone. Now, progesterone is really for those that have a YY chromosome or that are born females. And those are identical to the natural molecular or chemical structure of the hormones that our body generates versus another animal. So is bioidentical hormone replacement therapy right for you? Well, it can help both men and women bring their hormones back into balance to alleviate symptoms. One of the symptoms that I'd like to talk about today is fatigue, because both men and women experience hormone imbalances that lead to feeling fatigued. Fatigue is a common symptom, and sleeplessness is just one reason to feel tired during the day. But feeling fatigued even after getting a good night's sleep may be caused by an age-related hormonal imbalance or hormonal changes that can be treated by using bioidentical hormone replacement therapy. Many men and women who feel constantly sluggish during the day tend to shrug it off because they aren't getting enough sleep. But men and women who experience unexplained or persistent fatigue should discuss their concerns with a provider to determine if an underlying condition could be responsible. And blood tests may reveal the sluggishness being caused by an hormonal imbalance. However, your provider should be getting those hormones. If not, then you need to pursue a provider that does. Hormones including estradiol, testosterone, thyroid, and progesterone. Again, progesterone is for only those that have a YY chromosome or who were born female at birth. And those are chemicals that control the processes such as your heart rate or temperature. And these powerful chemicals, when they're out of balance, even just by a small amount, they can cause a variety of symptoms, including feeling tired and having trouble sleeping. So what are causes of fatigue? Many people say they feel tired all the time without knowing exactly why. Occasional fatigue can usually be chalked up to staying up late at night or a stressful time at work. But chronic feelings of fatigue and listlessness are often caused by underlying issues. Effectively treating that fatigue requires a provider who can zero in on a specific cause or causes. So a list of potential causes besides the insomnia include anemia, depression, an insulin resistance or diabetes, not drinking enough water or dehydration, excessive caffeine use either through coffee or energy drinks, heart disease, undiagnosed urinary tract infection or a bladder infection, hypothyroidism, both traditional or subclinical hypothyroidism, food allergies, a nutritionally inadequate diet, so pretty much eating things that are not derived from nature, those that work shift work, which I did for many years, or sleep apnea, chronic fatigue syndrome or fibromyalgia, whose causes are really unknown, may also be responsible for feeling chronically tired. So what's insomnia? Insomnia is a sleep disorder in which you have trouble falling or staying asleep. The condition can be short-term, which is acute, or can last a long time, which is chronic. It may also come and go. Risk factors include a long-term illness, mental health issues, and also night shift workers also are at risk for not being able to sleep right. Acute insomnia can last from one night to a few weeks. Insomnia that is chronic when it happens at least 3 times a week for 3 months or more. There are different types of insomnia. Primary insomnia. This means that your sleep problems aren't linked to another health condition or problem. Secondary, this means you have trouble sleeping because of a health condition such as asthma, depression, arthritis, cancer, heartburn, pain or a medication or substance abuse like alcohol. You may have also heard about sleep onset insomnia. This means you have trouble getting to sleep. Sleep maintenance insomnia. This happens when you have trouble staying asleep through the night or waking up too early. Mixed insomnia. Well, with this type, you have a trouble falling asleep and staying asleep throughout the night. Paradoxal insomnia. Well, when you have this, it's you underestimate the time you are asleep, and it feels like you're asleep a lot less than you really do. So if you're experiencing fatigue or insomnia, you definitely need your hormones balanced, and you need to find a provider who works on optimizing your hormones, and preferably bioidentical hormones. So thanks for listening today. If you want me to talk about another symptom that you may be feeling or more about bioidenticals, please leave a comment at the bottom, and I will do so at my next video. All right. Thanks for listening today. Remember, my life, mi vida, is really about nuestra vida, and that is our life together, because we're all humans together. Have a great day, and I will definitely see you at my next video.